Module Overview. Medical documentation is the lifeblood of modern healthcare. It facilitates communication, supports continuity of care, informs diagnostic decisions, aids billing and insurance claims, and ensures legal and regulatory compliance. Within this complex system, abbreviations and acronyms serve as shorthand that allows healthcare professionals to document large volumes of clinical information quickly and efficiently. However, improper use or misunderstanding of medical abbreviations can lead to errors in medication, treatment delays, and serious legal repercussions. This module teaches you to confidently decode, interpret, and use medical abbreviations in clinical documentation across Canada, the UK, and Europe, enabling precision, patient safety, and international competence. 1. Introduction to medical abbreviations and acronyms. Medical abbreviations are used in patient histories, progress notes, prescriptions, lab reports, discharge summaries, referrals, insurance forms. They represent diseases, e.g., HTN, CHOSC, hypertension, procedures, e.g., CXR, TUS, chest X-ray, medications, e.g., ASA, aspirin, measurements, e.g., BP, blood pressure, time and frequency, e.g., BID, twice daily, locations, e.g., ICU, or ER. 2. Categories of medical abbreviations. 1. Category 2. Examples: body systems, GI, gastrointestinal, CV, cardiovascular, CNS, vital signs, BP, blood pressure, RR, respiratory rate, HR diagnostics, ECG, MRI, CT, CBC, BUN, LFT treatments, RV, IM, PO, PRN, NPO, BIDI departments, ICU, or ER, OPD, NICU patient status D/C, discharge, AMA, against medical advice, NKA, diseases/conditions, DM, diabetes mellitus, COPD, CHF, TIA. 3. Regional variations in usage. Understanding regional differences in abbreviations is critical for international collaboration. Canada uses ICD-10-CA, CPT, and DIN drug identification number standard documentation through CIHI and CHIMAUKNHS follows SNOMED NICE guidelines, and read codes avoids certain high-risk abbreviations due to NHS never events. European Union shares WHO ICD-10 and UMLS, but each country may have local codes, emphasis on multi-language compliance for international patients. 4. High risk and do not use abbreviations. To reduce clinical errors, regulatory bodies discourage the use of certain abbreviations. 1. Abbreviation 2. Do not use. 3. Why? U yes mistaken for 0 or 4. Write unit QD yes mistaken for QID. Write daily. IU yes mistaken for IV. Write international units. MS. MSO4. Yes confusion with morphine or magnesium sulfate. Greater than, less than yes misinterpreted. Write greater than less than follow ISMP and Joint Commission safety guidelines for abbreviation usage in documentation. 5. Electronic health record, EHR, and coding integration. Medical abbreviations are used in ICD-10 codes, e.g. I10 equals HTN, SNOMED-CT, and codes over 300,000 clinical concepts, SOAP notes, subjective objective assessment plan, audit trails, billing and reporting, example EHR note, PTCOSOB, VS, HR 98, BP 140/90, DX, CHF, TEX, IV, Lasix 40 mg stat. Translation: patient complains of shortness of breath. Vitals: heart rate 98, blood pressure 140/90. Diagnosis: congestive heart failure. Treatment: immediate intravenous Lasix 40 mg. 6th, common abbreviations. Glossary first, abbreviation second, meaning PEAT patient DX diagnosis, TX treatment, HX history, FX fracture, SOB shortness of breath, NPO nothing by mouth, nil per OS, PRN as needed. BID twice daily, Q 4 hours, AMA against medical advice, W&L. Within normal limits, TIA transient ischemic attack, COPD chronic obstructive pulmonary disease, CABG, coronary artery, bypass, graft. Learning outcomes. Upon completing this module, you will be able to interpret and use hundreds of common and advanced medical abbreviations and acronyms, recognize and avoid high-risk or restricted abbreviations according to ISMP and WHO standards, understand how medical abbreviations are used in real-time clinical documentation and EHRS, apply knowledge of regional and global differences in abbreviation use across Canada, UK, and Europe, demonstrate proficiency in clinical documentation that meets audit, compliance, and accreditation standards.